It's often true that where you're experiencing pain isn't necessarily the area that is causing the pain. For example, if you have soreness in your elbow, it's likely that the chronically tight muscles in the forearm that attach at the elbow are the cause of the problem. Release the tight muscles and the elbow pain goes away. You will be surprised to find sore spots that you never knew existed in your muscles. Go slowly and gently at first. Think of yourself as your own maintenance therapist as you discover what painful patterns are in your muscles due to overuse in your job, sport, or activity. Use as much pressure as you need to give a sense of useful pain, a feeling that something good is happening. Apply enough pressure to give the "ooh, hurts good" sensation instead of "ow, hurts bad." You are always in charge of the pressure, so go slow at first, using Armaid for 2 to 3 minutes, 2 to 3 times a day in the beginning. You may have a degree of soreness the day after first using Armaid. This is perfectly normal, and soreness will dissipate as you use Armaid on a regular basis. The 5 roller attachments have different levels of density and effect. If you're using a particular attachment and it's too painful even with light pressure, switch to a softer attachment. Watch the 3 therapies video to learn the right techniques to use. Watch the 5 therapy rollers video to learn what each attachment can do for you. If you have any questions about anything, give us a call. We'll be glad to help you.